Mogadishu's Martini Hospital, which dates back to the Italian colonial era, is Somalia's only medical facility dedicated to treating its growing number of corona patients. Due to its limited capacity, the hospital only caters for the sickest of patients. This doctor runs the task force that is leading Somalia's response to the pandemic.
At least 218 patients of corona have come to Martini Hospital since the outbreak. 21 of those were admitted to the few beds available. 17 people are still here, while 3 patients died at the hospital.
It's hard to tell the severity and spread of the virus in Somalia. Until recently, the nation lacked the capability to test for the new virus, meaning samples were sent abroad and results delayed for more than a week. There is also limited capacity by the government to trace people the first victims of the virus came into contact with. The good news, however, is that 4 people have so far recovered from the virus. BASHIR ADAN is one of them.
I was provided good care by the doctors and the nurses from the day it was confirmed I had the virus. They also gave me good counseling when they broke the news to me, so I was mentally prepared for everything I went through.
All international and domestic flights, except for emergency medical and food cargo, have been suspended. The borders have also been closed as part of an all-out government effort to stop the spread of the disease. A massive public awareness campaign has also been mounted in the capital and in the media.
We're encouraging people to practice social distancing. We're also alerting them about what the virus is and the effect it can have, as well as the importance of washing their hands and disinfecting any equipment they're using.
Beyond the capital, though, Al-Shabaab fighters hold sway in many parts of rural Somalia. This means there is little access for medical and humanitarian workers to carry out life-saving work. Al-Shabaab fighters also carry out frequent attacks in the capital and other major cities, something else that hinders a proper response to the outbreak. There are now increasing fears that the disease will spread through camps housing displaced families who huddle under huts built from sticks and old rugs. Many of the 2.4 million Somalis displaced by conflict and other disasters over the years live in camps like this one. A critical shortage of medical supplies and personnel also continues to grip hospitals across the nation, with some doctors and nurses now saying they are increasingly being forced to choose between the health of their patients and their own. Mohammed, Adow, Al Jazeera.